Can you monitor blood glucose levels without a finger prick test? Emerging technologies aim to measure glucose through the skin, but as of mid-2025, no truly non-invasive device holds UKCA or CE marking for clinical diabetes management in the UK. Are non-invasive blood glucose meters actually safe to use for managing diabetes? And what does the current evidence say about whether they work? That's exactly what we're covering today, because this question comes up a lot and the answer really matters for anyone living with diabetes in the UK. Millions of people in this country need to monitor their blood glucose regularly. For many, that means finger prick testing multiple times a day, which can be uncomfortable, inconvenient, and for some people genuinely distressing. So it's completely understandable that devices promising painless, needle-free glucose monitoring sound incredibly appealing. Non-invasive blood glucose meters work by placing sensors on the surface of the skin, often at the wrist, fingertip, or earlobe, and using technologies like near-infrared spectroscopy, Raman spectroscopy, or photoacoustic sensing to try to estimate glucose levels without any skin puncture at all. The science behind these approaches is genuinely interesting, and research in this area is ongoing. But here's what you really need to know right now. As of mid-2025, no truly non-invasive blood glucose meter holds UKCA or CE marking as a standalone diagnostic device for diabetes management in the UK. That's the regulatory standard confirming a medical device has been validated as safe and clinically accurate for its intended purpose. Without it, no non-invasive device can safely replace your current validated monitoring method when it comes to making treatment decisions. This isn't just a technicality. Both the MHRA, the UK Medicines and Medical Devices Regulator, and the FDA in the United States have issued warnings specifically about smartwatches and smart rings that claim to offer non-invasive glucose monitoring. These devices have not been validated for this purpose, and both regulators have flagged them as a patient safety risk. To be clear, do not use smartwatch or smart ring glucose features for diagnosis or to guide any treatment decisions. There are also important technical limitations worth understanding. Factors like skin pigmentation, peripheral edema, hydration levels, and temperature can all significantly affect how accurately these technologies read through the skin. And these aren't minor variables. Now, if you're finding finger prick testing difficult or burdensome, there are clinically validated options worth discussing with your doctor. Continuous glucose monitors, or CGMs, such as Freestyle Libre and Dexcom devices, are minimally invasive rather than fully non-invasive. They use a small sensor just under the skin, but don't require repeated finger prick tests throughout the day. These are NICE recommended and available on NHS prescription for eligible patients with type 1 or type 2 diabetes. It's worth noting that even with a CGM, your care team may advise an occasional confirmatory finger prick in certain situations. For example, if your symptoms don't match your readings. Always follow your care team's guidance on this. Eligibility for NHS-funded CGMs also depends on your individual clinical circumstances and local pathways, so your doctor or diabetes team are the right people to advise you. If you have concerns about the accuracy of any glucose monitoring device, you can report this to the MHRA through the Yellow Card scheme for medical devices. There's a link in the description below. And as always, please don't make changes to how you monitor your glucose or how you manage your diabetes without speaking to a healthcare professional first. So, to recap, as of mid-2025, no truly non-invasive blood glucose meter is approved for clinical diabetes management in the UK. Smartwatches and smart rings claiming glucose monitoring have been flagged by regulators as unvalidated. Don't use them for treatment decisions. And if you're struggling with your current monitoring routine, validated CGM options may be available on the NHS, so it's worth that conversation with your doctor. Have you tried a CGM or have questions about glucose monitoring? Drop them in the comments below. And if you found this useful, please give it a like and subscribe to the Bolt Pharmacy channel for more evidence-based health information.